Hello everyone, my name is Nina and I'll be doing the APRN practice issue presentation on Assembly Bill AB 890. So background regarding how this bill came to be, members of the California Association of Nurse Practitioners, the CANP, worked alongside a coalition of 80 plus organizations to raise awareness towards the severity of California's growing provider shortage, and their ultimate goal was to demonstrate that nurse practitioners can help Californians, and particularly those individuals that live in underserved and rural communities because they need access to healthcare. So AB 890 will allow nurse practitioners to work without physician supervision and provide more direct care for patients. So the timeline for how this bill came to be, on January 23rd, 2020, the Assembly Appropriations Committee approved the bill and it was sent forward for a vote by the full Assembly. January 27th, the Assembly passed the measure by a bipartisan vote of 61 to 1, and the bill was heard by the Senate Business and Professions Committee on August 8th and passed with a 7 to 1 vote. It was then placed in the Senate Appropriations Committee suspense file on August 18th, and it was successfully passed out of the committee on August 20th. AB 890 was passed on California legislature on August 31st, 2020, and then signed into law by Governor Gavin Newsom on September 29th, 2020. And this bill will go into effect in January of 2023. Background continued. So essentially, AB 890 will create two new categories of NPs to function independently within a defined scope of practice without standardized procedures. So this will be the 103 NP and the 104 NP. The 103 NP is named in reference to the Business and Professions Code, section 2837.103, and these will be the NPs who meet certain educational and training requirements and are authorized to practice without standardized procedures if they are practicing in a facility with a physician. They are also required to have a transition to practice of at least 3 years or 4,600 hours. The 104 NP is named in reference to the Business and Professions Code section 2837.104, and these NPs are permitted to practice in a setting without a supervising physician if they meet additional requirements, such as including a master's degree in nursing and 3 years of practice in good standing as an NP, in addition to the transition to practice 3-year requirement. So current dilemma and issue, there's currently a nationwide shortage of physicians, and the state of California is significantly impacted. And this is due to an aging U.S. population. So a lot of baby boomers are getting older, they're getting more sick, they need more health care. There's been population growth and a greater need of insured individuals under the Affordable Care Act, otherwise known as Obamacare. And the healthcare demand is growing at an unprecedented rate. So in order to compensate for this, we also need more physicians to care for these patients. There also is a need to improve quality of care and increase access to primary care to improve patient outcomes by having an adequate supply of healthcare providers. And by 2030, California will have one of the largest physician shortages of 32,669 jobs. The key reasons for the shortages, like I said earlier, is because of a high physician demand from growth of total population, aging state population, and also aging physicians. The state population and elderly population will grow by 112% and 148% between the years of 2017 and 2030. And 33.4% of active physicians in California are over 60 years old and within 5 years of retirement. So we need more physicians to replace the ones that are going to be retiring soon. From 2006 through 2016, the number of medical students at a Doctor of Medicine MD and Doctor of Osteopathic Medicine DO schools have increased by 20.7%, But based on the current trend, the number of newly licensed physicians per year is simply just not enough to replace the physicians as they retire, and the physician demand will outpace the physician supply in California. So, the impact that AB 890 will have on practice in California is that it will bring California in line with over half of the states in the US by allowing NPs to practice independently and to the full extent of their education and training. The implementation of AB 890 will hold great promise for the state of California to expand access to high quality care. And it was really highlighted during the COVID-19 pandemic because the demand for healthcare professionals really surged. And practice will be impacted in three ways. So, one, access, two, quality, and three, cost. So, under access, physician supply meets half of the current demand of patients, and restrictive practice laws pose obstacles to nurse practitioner practice, such as practicing with a supervising physician, which further exacerbates the provider shortages and contributes to healthcare access issues. Also, NPs move to states that have full practice authority after getting their license. That way, they can practice to their full scope of their training and education. And increasing projected growth in NPs and PAs can fill gaps in physician shortages in California. Quality. Restrictive practice laws are in place due to the shorter length of education for NPs and a narrow focus on primary care. However, research has shown that NPs provide the same and in some cases higher quality of care than physicians, even when they are practicing without supervision from a physician. And this is because NPs have a nursing background as well as an extensive clinical training and education as a provider, which allows them to care for the whole individual rather than the diagnosis that needs to be treated. So NPs kind of have an upper hand because they have previous nursing background and on the job training, and they're able to combine that with the medical model and medical training that they received in NP school. And in turn, that makes them a better provider because they can care for the whole patient rather than just simply treating the patient as a diagnosis that needs to be treated. Also, costs, so limiting the number of practicing NPs, especially in rural areas, reduces access to care, and this will lead patients to use more expensive services like calling for an ambulance, which will lead them to be in an emergency department instead of seeking care for a health concern such as bronchitis. Studies have also shown that NP's cost of services is generally less than a physician's cost for the same services. There have been arguments made regarding Assembly Bill AB 890, particularly from the California Medical Association, which they feel strongly that physician-based care ensures the greatest patient safety and highest quality of care for patients. And they also believe that providers with less training than physicians may increase costs by ordering more tests and procedures. So, for example, diagnostic tests like x-rays, ultrasound, MRI, laboratory blood tests, the whole 9 yards. And AB 890 would allow NPs that do not have adequate training or years of education to be qualified to practice medicine without physician oversight. The California Medical Association also believes that allowing NPs to practice without physician supervision threatens patient safety and increases overall healthcare costs due to overutilization of diagnostic tests and improper specialty referrals. So my stance on the issue is that AB 890 will help bridge the provider gap, but it will not close the provider gap. And it's also not the only solution to address the physician shortage because this is going to be a temporary solution. So in the state of California has restricted practice compared to other states that allow full practice authority. So we need to come up with a way where the state of California can retain the nurse practitioners after the students graduate college, graduate from their master's program and get their licenses. We need to retain them in the state of California, and there needs to be some type of solution in regards to that, because we're losing too many of our nurse practitioners to other states that are allowing full practice authority, and these NPs are getting drawn to the states because they're able to practice to the full level of their education and training. Also, many nurses are no longer furthering their education due to great pay at bedside. We saw this during the COVID-19 pandemic. Not many nurses went back to school to further their education because simply the pay was too good to pass up. And a lot of RN positions have a clinical ladder, so nurses can always move up the clinical ladder. That includes, getting more certifications, training more nurses, and also getting more knowledge and experience in the department that they're working in. And many nurses don't want to go back for their master's because as a nurse, there's less stress for them and less autonomy than being the provider themselves. So all of these factors may eventually contribute to an NP shortage because this will also contribute to the provider shortage in California. And based on what the California Medical Association said regarding nurse practitioners, I believe that physicians are not the only healthcare providers that are highly educated, trained, and skilled. Nurse practitioners, CRNAs, PAs, the list goes on. They provide more patient advocacy and they have better bedside manner, and they provide compassionate, holistic care, all while incorporating evidence-based practice into the care that they're providing. So I believe that AB 890 will help bridge the provider gap, but there also needs to be other solutions that need to be made to help the provider shortage in California. So the two new classes of NPs, that they will have the ability to consult and refer patients to physicians when they think, a referral is necessary, and having NPs being less supervised will allow more patients to be seen by NPs due to less time discussing plan of care with physicians, and it will improve wait times and allow more access to healthcare for patients. I also think that Patricia Benner's novice to expert theory comes into play here because within 3 years of an NP practicing, they should be more knowledgeable and more comfortable as a provider. So essentially, that comes into play as well because they're not saying, this bill is not saying that new grad nurse practitioners are able to practice on their own. No, because they're not going to have the knowledge and expertise at that time. They will need physician supervision. However, NPs that have been practicing for a while and they have experience, they have knowledge, they should be allowed to because they've already encountered a lot of different situations and gained knowledge. So all in all, in summary, the quality of care that will be provided will still be the best quality of care, and the ultimate goal will be to improve patient outcomes. So 2 questions that I have are, what are the 2 new categories of nurse practitioners that Assembly Bill AB 890 will create? And number 2, what will Assembly Bill AB 890 allow for advanced practice registered nurses, APRNs, specifically nurse practitioners? And these are my references. Thank you.